many of the issues that are present in the conventional field as far as the evidence and the safety and how to know what to do and where to bring that in really takes time with supplements too. And it can be quite overwhelming to try to get good at too many things at once. So one of the things we would recommend is to get good at using, one thing at a time. Even more important than that, as you all know, is building that initial relationship of trust with the person in front of you.
As we discuss the data, many of the studies are small and underpowered and have shown small benefits, small but significant benefits. And so I just wanted to mention that it's not that we can't be effective with using nutraceuticals, but more so that there are a range of what can be helpful for patients, and depending on what the families are looking for and how much energy they have to invest in this. For some families, they just want one thing to help the kids sleep, along with traditional or conventional medications. And other families don't want any of that. And so we're going to be addressing that as well, how to look at what level of intervention to apply. Many youth use nutraceuticals. Here are the statistics. 28.9% used one or more types of CAM therapies. And this figure is twice that of those without mental health concerns. So many people are looking for nutraceuticals. And this was a survey done for youth between the ages of 7 and 17. So when we're looking at vitamin D, we know that, and I'm talking about in children when I'm saying the only data that we have that I'm aware of when looking at depression. Now, as far as monitoring, anytime we check a vitamin D level, we also want to check a calcium level because an abnormally elevated calcium concentration in a patient with vitamin D deficiency could be because of hypercalcemic disorder, with primary hyperparathyroidism being the most common. So you don't want to give somebody with hyperparathyroidism more vitamin D. Rather, you would want to address that. My thoughts are those who are taking antidepressants. So kids who are taking antidepressants, I like to know their vitamin D level because studies in adults suggest a negative association between SSRI use and bone mineral density. And during adolescence is when a huge amount of bone is being placed and consolidated. So there's a greater rate of bone loss with SSRI use and increased risk of fractures in adult studies.
B12, we really don't have a lot of studies looking at adolescent depression using B12. I, in my practice, do check it, and it's rarely low, but I do supplement. And again, with the broad spectrum micronutrients, it's an easier way to get a lot of this addressed without having to look at each little thing and trying to replace it.
Essentially, L-theanine is a great one. The only study that's really been done in kids is looking at boys with ADHD, showing that their sleep efficiency improved.
L-theanine is one of those easy things to use when you see someone with anxiety and you don't have time to figure out exactly what's going to be the best thing, and they have a little bit of sleep trouble too. Something pretty safe to start while you're doing your workup and getting labs, etc. Because a lot of times they come back in 2 or 3 weeks and they're like, oh, he's already, a little bit better with anxiety, sleeping a little better. So it tends to be an easy thing to add on early on.